This presentation is presenting a solution to the problem of rural medical workforce. This issue of maldistribution of doctors between urban environments and rural environments is a universal problem. It's not unique to my country, and it's certainly a problem in India. It's a problem in both developed and developing nations. So there are many ways that governments using policy settings can try to improve this situation, incentives to doctors to work in the country and so on. What I'll be talking about in this presentation is a medical education approach or solution. We've demonstrated that by educating medical students, senior medical students who are in their clinical years, in the country for a whole year, they spend a whole academic year with us, it increases the likelihood fourfold that they will return to country practice. So we've known for many, many years that rural origin students are more likely to go back to the country after they graduate from medical school. What's wonderful about our recent paper is that we've demonstrated that by attending medical school in small rural settings for a whole academic year, that urban origin students are nearly 4 times more likely to go back to the country. And we add value to the rural origin students. They're now more than 4 times more likely to go back. So the presentation will discuss the development of essentially rural medical schools, not simply a regional medical school, but a highly distributed model in which small numbers of students are located in small population centres scattered across literally millions of square kilometres in Western Australia. And how we've done this, how we've had to invent new ways, if you like, of doing medical education, how we've overcome the barriers to doing this in Western Australia. Now, I wouldn't presume for a minute to suggest that this is something that India should be doing. Clearly, India will have to do what India can do. All I'm presenting is at least the possibility, at least demonstrating what we've done, that might generate ideas and at least some optimism about how this can be achieved. And I'll be going through a series of innovative developments within medical education that have made this possible, as well as a little background about the simple exercise of developing the infrastructure, the human resources, and how to actually make it happen. How do you build a medical? It's such an overwhelmingly difficult problem for most countries that it generates pessimism and passivity. You know, it seems like it's just too hard to solve this problem of getting doctors to the country. So the first message that I hope that the delegates take away from this is the possibility that it could be done. That with innovation, thinking out of the square, doing things different, and that is possible. The barriers still exist. There's financial distance and so on. And not to mention, to be honest, resistance from the traditionalists, if you like, in the urban medical school. It took a long time for people to be able to get their head around this and see that it could be done. So it's partly about enthusiasm, partly about the possibility of it doing, and then the message is about some of the details of how it's done, and then finally, what are the medical education innovations that we've had to develop that could be adopted by India to produce a very similar model in India.